Good afternoon, everyone. Thank you so much for joining us today for a webinar talking about the importance of vaccinations and vaccines in the fight against COVID-19. So today we have with us two of the main people in our community that are making this happen, and not only making it happen, but making this rollout so successful. We have Clay Horton from the Green River District Health Department and Dr. Michael Kelly from Owensboro Health. Before we start today, I just want to thank both of you for being here with us today. I know how busy your schedules have been. It's been a crazy week for both of you too, but we're just really grateful for the leadership that both organizations and you two specifically have given to this important rollout. It's been professional. The customer service when you go to any of the sites in the community has been remarkable. The streamlined approach, it's impossible not to be proud of the work that you've both done and both of those organizations have done in our community. It's just another reason that that Greater Owensboro is a great place to be. So Clay, we'll go ahead and let you start this off.
Well, thank you, Candace. I always appreciate the opportunity that you provide us to talk to your chamber membership, and it's a great partnership, and we're happy to try to reach out and let folks know about what's going on. You know, our story in the community in terms of COVID-19 vaccine rollout. It seems to me like it's gone very, very quickly. It continues to evolve, and the challenge continues to change. And we're really in a phase now where we're having a lot of success in terms of rolling out vaccine. I go to a lot of our clinics, our clinic days. They're joyous occasions. People are happy. People are finally getting that vaccine, and it makes for a really enjoyable challenge. So we hear a lot from the business community. We hear a lot of inquiries about how they can get their workforce vaccinated, and really what I'm hoping that we can do today is talk through some of that. We get a lot of requests for on-site clinics. And up to this point, supply has been a challenge. The amount of available resources in terms of work or, manpower to deploy mobile clinics has been a challenge. And then, even though these are, remarkable pharmaceutical products, these vaccines and how well they work, they're logistically challenging. They have to have special storage and handling equipment. They are in multi-dose vials with no preservatives, so we have to have a number of appointments lined up, and they don't transport easily. Thought this would be a good chance to have a conversation about how we could work together to work through some of those challenges, and hopefully we don't have to reemphasize, what the benefits are to employers in terms of getting their employees vaccinated. It's going to keep your workforce healthy. It's going to reduce absenteeism. It's going to now with the new CD guidance, if you have someone that's exposed to someone with COVID-19, they're not going to be required to quarantine. So that's going to be a big boost to productivity, and it'll improve overall morale. Like I mentioned, our clinic days, they're happy occasions. People are finally glad that the logo or the slogan they've been using across the state is "Shot of Hope." They're finally glad to get that shot of hope. So what we're hoping is that we can get some help from the business community. We can help communicate to your workforces about the benefits and the safety of these vaccines. We hope that you all would be able to assist us with getting information out to your employees about how to navigate to one of these appointments, how to go to the Owensboro Health website, go to the health department's website, go to one of our retail pharmacy partners' websites and get signed up for an appointment slot, and then allow employees the time to do that and support them, and because it's all going to benefit not only your business, it's going to benefit the health of your employees, and it's going to benefit our community as a whole. So I know you've got a lot of questions lined up, and we're happy to try to field some of those. But with that, I'd like to introduce my colleague, Dr. Michael Kelly with Owensboro Health. He's been a great partner through our COVID-19 response. He and I didn't know each other until about February last year when we got together to talk about what is this COVID thing coming and what do we need to do. So we've gotten to know each other pretty well over the last year, and he's a great asset to our community, and I'm glad to continue to work with him.
Thanks a lot, Clay. To both of you, thanks for the introduction. I was going to start out with a little story of my morning drive in from work, and I'm going to put Clay on the spot, but I see Clay as I'm driving in walking the dog. I won't tell you how early in the morning this is, But I've thought about waving or rolling down the window or honking the horn, but I think that might be his moment of zen because he's been a very busy gentleman this last year. I spend a lot of time on the phone or text or different versions talking to Commissioner Stack, who also has only been in his position for about 14 or so months. And so I don't think anybody could have expected the amount of weight that falls on these individuals that are working in a public health department sector to try to navigate this pandemic, this surprise. Nobody really knowing if the cavalry was going to come, what the next thing that would happen would be. And then all of a sudden we have vaccine much sooner than expected. And we are in a place where we're able to kind of look at all these positive potential things that are happening. To Clay's point, some of the best days at this organization within the last year or plus have been actually the vaccine clinic. Just seeing people come in, and I joked, and I probably said the same joke before, but it was like getting Beatles tickets. People were, in the beginning, the doors were open. We were trying to have a soft rollout in the very beginning, and everybody with their walkers and dropping off, and employees and texting their friends to come in and get the vaccine. And the best part, I think, of this rollout and what's been done by Clay, now there's many other dots on the map and pharmacies that give you vaccines, including here, is that we've done a great job at the over 60-year-olds at getting those people vaccinated, which is where about 80% of the deaths occur. And so we've done a great job at protecting the most vulnerable. As we've moved kind of into being open to everybody, and I can't give the exact date, but we moved a little faster than the state did. And the state has actually upped their guideline to be open to everybody by, April 5th, but has given us the green light to do it to whoever. We've run into a little bit of less traction. The demand has gone down a little bit. The supply is no longer the issue. We have plenty of sites. We have lots of vaccine. And we need people to come and have willing arms to get vaccinated to protect them from not only the potential risk of death or hospitalization or ventilator or having to even come to the ER, from being out of work, from being laid up, from the risk to their family members. And then, unfortunately, some of these people are having COVID long hauler or long-term effects that we just don't know what that's going to mean yet. And so by vaccinating with 2 mRNA vaccines that are 90% plus effective, and also are effective at preventing any infection or even getting just asymptomatic infection. And now Johnson & Johnson has a single dose alternative, which is still leaps and bounds better than most first generation vaccines. We just need people to come in and get vaccinated. And I'm happy to provide myself as a resource, as Clay is, to anybody who wants to have a discussion about why they think they shouldn't get vaccinated. Because I think I can honestly dispel most of those concerns. There's going to be some people that are going to, no matter what, not want to get vaccinated. But I just want people to have the right information to be able to make the right decision. So that's all.
Fantastic. And really, the information piece, we find so often when people get their information in sources that aren't, expert sites or expert places, that it becomes misinformation. So thank you. That's why it's so important for you all to be here. I have some questions that have already been submitted. If you all wouldn't mind, I'll go ahead and start asking these questions. Can Kentucky workplaces require their employees to be vaccinated?
Probably, yes. So, I mean, there's certainly the vaccination is not required by the federal or the state government. Employers may have that flexibility. I've gotten this question a lot and have done a little bit of research on it, and the EEOC put out guidance for businesses on requiring H1N1 influenza vaccine several years ago, and that would all be applicable to COVID-19. So if you're, I'm not an attorney, I'm not the head of an HR department, but I'd say that if you're looking at implementing a policy like that in your workplace, seek out that guidance. It's going to require some exemptions. There obviously would be exemptions for folks that have medical conditions that would counterindicated for a COVID-19 vaccine or have allergies. There would also be exemptions for religious reasons. But I think that probably we're at the point now, and especially if you're a business that's subject to the ADA law, try really encouraging your workforce first. I think that, that would be the right approach. I think businesses should be patient. We've talked a little bit about trying to overcome vaccine hesitancy. We've tried to build confidence. We're trying to dispel any misinformation. And so don't make this as a one-shot deal in terms of talking with your workforce about encouraging them to get vaccinated. Provide the opportunity, provide the support to do it. A month later, give them another opportunity. Let people become more comfortable when they see their coworkers, they see their family get vaccinated and not have bad outcomes. They can see the positive way that our community is moving. Then I think that we'll have some folks that maybe want to go a little slower at first, but they'll come around. Here at the health department, we're moving with a lot of urgency in terms of the number of people that we're getting vaccinated. And, we work very hard to fill all of our appointment slots. But I think on the individual basis, educate yourself, educate those that are around you, and let people come around to it when they're ready.
I can give a little personal experience here if we want to do it that way. We both kind of, I think that I would rather have, use carrots than sticks right now for some of this. And you're starting to see some case law out there in different parts of the country regarding this. In vaccination, there is case law regarding people who've had a reason that they didn't want to get vaccinated in the healthcare system, and that healthcare system may have parted ways with that individual, and lawsuits have been brought out, and they can linger and go on forever. So in most cases, there is a path where an employer could to do that. Well, I'll use the flu vaccine, for instance. Here, our policy is we want everybody to be vaccinated. There's going to be some of those exclusions, but if you don't get vaccinated, then you have to wear a mask. So at this point, everybody's wearing a mask in the hospital all the time anyways. So it's a little bit hard to say that there's we're differing out between people. We keep kind of sending the same messaging as Clay said, to try to get more people to come. We realize there's a fair number of people that we want to wait to be 90 days out from their COVID diagnosis to get vaccinated. The ones that I'm seeing most of, although what you'll hear in the world, out in the world or in the press, is that 50% of Republican men, right? That's been out there, don't want to get vaccinated. I think that may or may not be true. But the ones that I see more, I think, are part of our staff are women that are of childbearing age that generally are going to have a reasonable outcome for this, and they just don't know what the long-term effects on fertility and such are. Right in the beginning of this, there was some misinformation about this. The American College of Obstetrics and Gynecology, the American Breastfeeding Association, a lot of different avenues of deference to expertise of people who do this have recommended that women of childbearing age get vaccinated, women that are pregnant get vaccinated, women that are breastfeeding can get vaccinated. And so, in fact, babies actually have evidence of antibodies from when born to a mother who's been vaccinated. So there is some benefit to this, and we're not seeing any downside in those individuals. But these are some of the areas. I think if we make sure that we've done all of those things to our employee base and given that correct information and keep messaging and keep going through it, I don't think that we're going to have to go as far as mandate. That's my hope. Even for the flu vaccine, it's 75, 80+%. So it's very hard to get all the way there.
That's still fantastic, and that's great to know. I know we have several. We've had several questions about with women in childbearing age, if it was going to impact the fertility issue too. If you're having fertility problems and you're working through those, so you're saying that the American Association of OBGYNs have said this is not going to impact that. Please go ahead and get your vaccination.
That's the best. I mean, obviously, we haven't been able to study this long term, which is, I understand people's fears about this, but there's no evidence that this type of vaccination, an MRA type of vaccination, for instance, should lead to fertility issues. Now, I always defer, as the last statement, to talk to your obstetrician, your gynecologist, your primary care physician, the person you have a relationship with. But when I've talked to them, our chief of staff is an obstetrician, Andrea Moore. And I've talked to her about these issues, and she said, I can't draw a line in the sand or a direction A to B from vaccination to infertility. I just don't see how they're going to ever be related. So for her, as one person, and we try to, I think Clay sees this, I see this, a lot of the medical staff is always looking for the latest, greatest thing that comes out, but we have to find the high impact journals, the best sources of truth to kind of look at. And so these governing bodies that get together at a table, have an expert consensus document and put it out there are saying it's safe.
That's great. That's great. So once we're going through this with the vaccination periods, can an employer require proof if someone claims to have been vaccinated? I guess it's up to the employer, especially if you're in the private sector, to require proof.
I don't think they can require them to provide other medical information, but they could ask for proof of vaccination.
Yes,
that's great.
We have currently on our badges here a little tag that says you've been vaccinated for the flu, right? And there's a HIPAA issue, some of this stuff and all that. So we could also have and these colors change every year to see that you've been vaccinated for the flu with the flu vaccine. So we could have something that mirrors that, which you could say is that sort of breaking some sort of HIPAA or, compliance issue. But in general, in a pandemic, in this whole scenario, I think it's good right now that that the people that you may be sitting at the lunch table with, and if you, by CDC guidance, are allowed to maybe have your masks down to be within them because that's the guidance from the CDC to have lunch, I'd like to know that other person is vaccinated.
Absolutely.
And while I'd like to take everybody at their word, it's not oftentimes the case that we can take everybody by their word. So.
Well put. So if an employee has already had COVID, and we kind of touched on this earlier, but should they still be vaccinated?
Yeah, we could. Yes, that would be the short answer. Some people have brought up some variations on that theme to me. Would I be better off getting the Johnson & Johnson vaccine rather than a 2-shot vaccine if I'd previously had COVID? That had been posed to me by a physician. And I said to him, I don't have any proof that would be reasonable, but that may be a better choice for you to get a single dose vaccine as somebody who's previously had it because your body's already been exposed once. And so the vaccination in some ways might serve as a booster. There's no evidence to support one direction or another. As most people are saying and most people are hearing, if there's a vaccination available to you, get the vaccination that's available to you. Whichever.
Yeah, and I'm always careful about answering the medical questions, especially when we've got someone like Dr. Kelly with us that's an expert. But there's also some suggestion that the immunity from the vaccine is stronger than the natural immunity from infection. So absolutely, we would encourage folks to get everyone to get vaccinated.
That's a really good point. That's absolutely true. I mean, there was 6-month data out of Mass General who very early on tracked this in Boston, and they saw immunity from natural infection going out to maybe 6 months in some of their healthcare workers. But after that, the titers really trickled down. And what we're seeing for vaccination is we hope that it's going to last much longer than that. And that's what we're seeing already kind of in Israel and other places that were early adopters of vaccine, that their immunity seems to be more prolonged, longer lasting, more durable.
So since you brought up the any vaccines, what's the difference between the Pfizer, the Moderna, and the Johnson & Johnson?
Well, other than there's different cold chain storage issues related to it. So some of those, Pfizer's the one that requires the -60, -80 freezer piece. Pfizer's the one that wants to do the booster the way it was studied, really at a different time interval than Moderna, a little bit shorter at 21 days versus 28 days on the Moderna. And then Johnson & Johnson is really an adenovirus sort of technology that we've used before. It's not a live virus. So the single dose technology, but Moderna and Pfizer are the same basic mRNA technology, just the way in which they studied it, the way they got there, the way they stored it, and the way they did their studies are different. I don't know if you have anything to add about those two, Clay. And then the technology that's used for Johnson & Johnson has been technology that we've used in other sort of adenovector viruses. It's not a live virus, so it's not anything like that, but it was something we've done before, and we've used that same technology, and their efficacy was upwards of 70%. So they still had pretty reasonable, decent efficacy. And the most important thing about all three of these, to split hairs on what's different about them, is people don't die when they get these vaccines. People aren't ending up on ventilators and hospitalized with severe illness. So while you may get, efficacy is a tricky number. Efficacy may mean how many breakthrough infections you get, how many people get kind of ill. But what you're not seeing is you're not seeing death, and you're not seeing ventilators, and you're not seeing intensive care unit in people who've been vaccinated, which is probably the most important thing.
Absolutely. So let's go to just a couple of workplace specific questions, and then I want to talk about after the vaccine. Okay. So how can, if someone's interested in their workplace becoming a local vaccination center? Clay, you kind of touched on this before we went live.
So I think, I think there may be a time and a place for that. Right now we've got our hands full, and the hospital is just a vaccine factory right now. I mean, they're vaccinating thousands of people a week and keeping up with the booster doses, and they're carrying our community through this. But but at this point, we have not been able to offer on-site clinics for employers, just because our focus is vaccinating as many people as we can in the community as quickly as we can, and we want to do that in a fair, equitable way. So we've not walled this off and done private type clinics. So there may be a time where we have more resources, we may be able to do that, and that may be a good avenue for us to reach folks in our community that otherwise may not get vaccinated. And I don't want to completely say that, shut the door on that possibility. But I think where we are today and where we need to get, what I would ask our business community partners to do is not wait for that opportunity. Seek one out now. There's multiple avenues to get vaccine within our community already. We have on-site clinics with the hospital, the health department, lots of retail pharmacies. We occasionally we'll do some outreach for different areas of the community where we think transportation are going to be issues for folks. So if businesses can stay tuned with what is happening, where vaccines are available, and there's lots of good resources, online resources to seek out vaccine. Vaccinefinder.org is one. kycovid19.ky.gov is another place you can look up for available vaccine. You can even sign up there where you can get a text message on Tuesday morning who has open appointments in the community. Our website, healthdepartment.org, Owensboro Health has an online scheduling at their website. Get adept at finding those opportunities, navigate your employees to them, be flexible enough to allow them to go get vaccinated. I think that's probably in the best interest of everyone at this point in terms of timing. Now later on, there could be opportunities for the health department to partner with large employers where we can line lots of folks up to vaccinate. There may be retail pharmacy partners in the community that are willing to do some of that now. So I'm not, at this point, I think we're just trying to get it done in whatever way that we can do it. We recognize that all of our providers are going to have some flexibility and be creative and go about it the best way they can.
That's great. And along the line of what you said, Clay, we had at a board meeting recently, several of our board members started sharing things that they were doing to be not just to incentivize, because I think some people are actually starting to do some like gift certificates and just cash incentives. I've heard that, but also listen, after you get your booster, you get a day off, because they know, and all of us who've done that, some people have worse, some people don't have anything. Some people feel a little tired. Yeah. So it's just a matter of just encouraging people and letting them take off on their booster day. And you take your chances, you get a day off, right? So, and you might feel great and be able to enjoy it.
Yeah, I hadn't heard that, and that's a great incentive. And I think that also brings up another good point. And a lot of, and this is actually an advantage for doing, sending employees to a clinic setting. If we come and line everybody up on the same day and everybody gets their vaccine on the same day, you run the risk of having a lot of folks feeling tired on the same day. Right. So spacing that out, doing a little bit of planning about, how you stagger that. And I love the idea of the incentive of a day off after your second shot.
I mean, a lot of people do anything for a day off. And if you're really worried about it, it's okay. You go home and you enjoy your day. But yeah, that's been one that several people that I know are doing in their places.
I think people will do less, do the same for less. I'm kind of joking, but just I think people will incentivizing them is something we've talked about here to do the employer side. When Clay and I have discussions, we often talk that the hospital is kind of the workhorse. That we wanted to, Clay, do you have any list of large groups of people you need us to get done? Let's try to figure that out, whether it was Roosevelt House. So we've done a few of these high risk sort of things. But this week, for instance, we made a push to almost put 6,500 first dose vaccines into people by adding some health park sites and things like that. And just to get a sense of, for the clinic, when it's one site and we have immunizers, it takes 27 people to run our vaccine clinic, and we didn't hire staff to do that. So we find people who are overtime, or we find people that are willing to kind of come out, or the clinic's a little slow, and move people into a different area. So when we run full steam first and second dose, it's a large group of people to make that happen. So taking some of those people away for 50 doses here or 50 doses there is very difficult. And then we also have to operationalize the second dose for us, because we're mostly a Pfizer shop at this time. We get a very small number of Johnson & Johnson to our outpatient pharmacy. We didn't get any this week. So we get usually about 100. So we're really a 2-dose Pfizer shop. That's the least stable one. You take out of the -80 freezer. So we've got to take that in some place where it doesn't like to be shaken up. So just getting it somewhere can be a little bit difficult. And we just want to kind of try to have people come to us at this time. We're looking at some opportunities. We've done a few for certain populations at a church. We've done a few outreach for people who at the Medicaid population, where we're looking at through certain insurers to get out and maybe do 300 doses here and there. But for the most part, we kind of want to be stationary because of the amount of people that we need to run our day-to-day operation.
And so that kind of leads into another question that someone had, and that was about volunteering. So since you're wanting to keep it pretty central, and that makes sense with that staff number that you have to operate the clinic. So can people volunteer? Is there a need in the community to coordinate volunteers to bring people to sites right now? If someone wanted to start working on that and make that their community service project, is that a possibility of something that might be good to have?
I think it is a possibility, and we would have to talk about that individual about what they were interested in doing. We have a program here at the health department called the Medical Reserve Corps, and that is the avenue, the mechanism that we've been using to have volunteers sign up.
Very good.
Although I think that the majority of the volunteers that we have used have been nursing students. We've had nursing students through the community college. I'm not sure that we've done any with U of L, but we've had discussions with them. And so, we are using volunteers on some capacity, but healthdepartment.org is our website. Look for the Medical Reserve Corps, or what we refer to as MRC. And that is an avenue that we can get folks signed up. We can get them trained, get them covered with workers' comp, which is important in our liability insurance.
That's fantastic to know, Clay. And is that something that we can disseminate to people as they ask, if more people ask about volunteering?
Sure. Yeah. Medical Reserve Corps. There's other avenues as well, but that's the one that we have kind of maintained here at the health department.
Fantastic. So back to getting a vaccination, because I hear a lot of folks that are saying, well, I've been vaccinated and I can do anything I want. And they're out running around without a mask on, with some before their second, but also after the booster. Can you tell us, first of all, do people need to wear masks after they're vaccinated, and maybe give an explanation for the answer?
So I think the thing that I've been saying, and this isn't, this has kind of been the national campaign, the slogan that we've been using, is we still need to use all of our tools. There was data released this week about the effectiveness of these mRNA vaccines in terms of preventing infection, period. The early clinical trials were looking specifically if whether they prevented illness. All of the data that has been up to this point has been very encouraging and very promising, but we're not out of the woods yet. So, we don't want to move too fast. We don't want to give up the ground that we've gained the last probably 2 or 3 months. We are moving in a positive direction in the community. So right now, we're still asking when you're in public or when you're in, in a public setting, get vaccinated when you can, still keep your 6 feet of separation of distance, still wear your mask, and still wash your hands frequently. Now, CDC has put out some guidance about small private gatherings. And what they've said there is that if you're socializing in a small setting with other people that have been vaccinated, you don't have to wear a mask. So it's not time to go hog wild and have the big dance party. But in terms of small settings, we're making progress, and that should be. I hope the people find that encouraging, and we will get there as we get our community vaccinated. I don't know if you have anything to add to that, Dr. Kelly.
I can add not a heck of a lot. I mean, he said it well. I think we used to have a daily steering committee, which was a group of individuals, including myself, to talk about COVID. Then we kind of went to 2 times a week. We got to 1 times a week. Then we went back to 2, and now we're at once a week, just based upon it kind of mirrors what's going on out in the world. And at that committee, questions get brought in just like this to us on a daily basis from people within the organization. And 90% of them now are, what do I get for being vaccinated? When can I stop wearing goggles? When can I do this? When can I do that? I mean, that's what we're seeing. And there's sort of an overly exuberant group of individuals that want everything because they've been vaccinated. Mm-hmm. And I get it. We're all tired, but we need to keep up doing the same things. For instance, for us in the hospital, if we have a vaccinated individual who's not wearing their eye shields and they have a patient encounter and that person turns out COVID positive, even though they may not be overly symptomatic, that's not considered an exposure now because that person's been vaccinated. But if we have a person who hasn't been vaccinated, and right now we know that not everybody's been vaccinated anywhere, and they have that, it's considered an exposure, they would need to be off work until we could sort them out a little bit more, okay? And so they'd be an exposure, or somebody who could potentially turn positive or infect other people. To Clay's point about the new data that asymptomatic or no infections, probably 90%, that means 1 out of every 10 interactions, if everybody was vaccinated, could potentially put you at risk if you were not practicing the tools. So, it's much better than it was, but there's still risk out there. And I just, to Clay's point and to what everybody's trying to say is, hey, we're in the red zone. We're close to getting to scoring a touchdown here. Can't we just pump our brakes a little bit, keep doing what we're doing? We're going to try to get there. We're getting there. Get your vaccination, follow these rules, and we're all going to hopefully have a more open economy. For me, my selfish thing would be able to go to a concert. Outdoor, like I love music and so if I could even an outdoor show with some social distancing and feel like it had some sense of normal, I'd like that. And so I want people to do it. That's my selfish reason. My servant leadership heart tells me that I want to do it so people aren't coming into this hospital. I'd rather put myself out of business. So that's what I would rather see. So that would be the only thing I would add to it. So we just need to hold the course. So.
That's great. That's a very good way of putting it too. And here on the music venue for sure. I'm missing that too. So then if you talked to me, you had said that you could pretty much explain to everybody why they needed to be vaccinated. So we've talked through the female, the childbearing age. What if I'm just a regular healthy guy in my 30s and my wife's been vaccinated because she's a teacher and my children are under 10?
Why should I get vaccinated? Mm-hmm. Yeah, you could potentially get the infection, be a carrier, and give it to somebody who's high risk. So I mean, you just don't know. So many people had asymptomatic infections, or you could be the individual who gets it, that your kid, now that you want to be educated and be live in person school 5 days a week, ends up getting a small low grade fever and sends home the whole class and shuts down the whole thing. I mean, everything that you do is attached to another human being. So your behavior is not about you, it's about everybody else.
Yeah.
So
no man is an island.
Yeah. So that to me is it. And I don't know, Clay, you have something with that as well, but that's just the way that we see it. I mean, I've seen so many 6 degrees of separation to how to figure it out. And you guys have to try to track down this. And that's a huge undertaking to try to figure out who was patient 0, right? So
Yeah, I mean, and I think on top of what you're saying in terms of the, what's good for the greater good is also there's very little risk here. These are safe vaccines. Another additional upside would be if you get exposed to someone that's positive, you're going to be protected. Again, I'm not selling this as the only reason, but you won't have to be quarantined in our current guidance. So you won't have somebody from the health department calling you, hassling you, telling you to stay home for 2 weeks. They may just give you a heads up that you had an exposure, hear that you're vaccinated, and ask you to kind of, keep an eye on, make sure you don't develop symptoms for the next couple of weeks, but otherwise your life's not going to be disrupted. So I think there's an immediate benefit there. But the bigger benefit is that, if we can distill all of this down to the fact that it's going to save people's lives. It's safe and it's going to save lives. It's just a mild inconvenience to go and get signed up and get the injection. You probably owe it not only to your community, but you owe it to yourself. There's a lot of upside and very little downside.
Well said. Just a couple of others, if you all don't mind. One's about children. When can we expect vaccines to be approved for children?
It's a good question, and there's some data on Pfizer in the 12 to 15-year-old or 12 to up to the age of 16 that's probably in preprint server right now, which is sort of, I expect something maybe asking for the emergency use authorization for that in the coming weeks to months, but Clay may know more about what's happening on that level. And then there's more trials looking at younger and younger individuals to do that, the same thing. I mean, that'll be the next thing that we're probably talking about in 2 to 3 months down the road, about trying to decide whether you're going to vaccinate your 5-year-old, and those types of things, and what are you going to vaccinate them with. And so the trials are out there, they're happening. I haven't heard the first couple of thousand in that age group that were done. There were no bad outcomes or side effects to the vaccine, although they have a pretty robust immune response. So that with my second dose, I had to go home and take a couple-hour nap. And so kids have robust immune systems, so they're going to get that response. So we'll see how that plays out. But they're also a lot more resilient than us as we get older. And then the other part of this is it was 100% effective in the first 2,200 or so patients. So 100% effective at getting, so think about trying to get to herd immunity. When 20% of your national population is under the age of 16 or 18, it's very hard to get to herd immunity when the people that are able to get vaccinated right now aren't doing it as much as we would hope, and that you're excluding that 20%. So you hope that some group of getting those when we get those out, the people that are already vaccinated, we can get that up to about 70% or 80% of the people that want to get vaccinated. And then the rest of them may get us to herd immunity just because they've been infected before. So I think that more to come, but I would guess in the next month or two, you're going to start seeing emergency use authorizations from the FDA for the next tier, a few age groups down.
Good deal. Fantastic. So I think that's all the questions that we've had submitted. And I don't know if anyone, just for posterity's sake, Grits is actually providing free transportation. That was in the newspaper and Owensboro Times and I think other outlets in the last few days. And one of our attendees wanted to remind us of that. So thank you.
I heard Uber or Lyft may be doing something as well.
Great.
Those organizations. So
yeah, Grits is 100% free. And if you know of folks that are having barriers like that, you can always call us here at the health department. We're happy to help navigate that and know that we've referred folks to Grits and they're very accommodating. You got an appointment for a vaccine. It doesn't have to just be at the health department. They'll take you anywhere. I think we're within one county over. So as long as you have an appointment. So they're doing their part and helping us all kind of get where we want to get.
Great, thank you. Well, are there any closing remarks that either one of you all would like to have?
I just want to say thank you again. Thank you to the chamber. Thank you to our business partners. We've worked with all of you a lot over the last year, and really appreciate the support that you all bring to our community. And please reach out and let us know how we at the health department can help you with your workforce and whatever your needs are.
Thank you, Clay.
The same goes here. I'm always a resource to try to answer questions or find somebody smarter than I to answer that question. And if there are issues or barriers you feel like you'd like to try to share about trying to get your workforce vaccinated as far as getting them here, we'll try to listen to it and see if we can come up with a solution or collaborate with Clay to try to come up with that as well. There should be a larger bolus. I think Clay's already gotten some of that at the Johnson & Johnson, the one shots, which it makes it a little bit easier because you get one and done. I think that's a little bit of how some individuals really want that. They don't care about the difference in efficacy, nor should they at this point. But anything that I can do to assist, just feel free to reach out.
Thank you both so much for all your work. And as I said, for just the professional way that you've done this, it's made us so proud of our community and both your organizations. And for everybody who's listening, you have people that are waking up, they're barely sleeping and then waking up every morning trying to get us through this. So, there's only a couple of small things that we can all do our part. So I encourage you to do your part to keep this going, to keep our community moving forward so we can get to the other side of this together. And that we're getting there soon. Thank you all so much. Have a good day.